Hi, I'm Dr. Sebastian Gonzalez, and today the topic is going to be high hamstring tendinopathy. High hamstring tendinopathy is something that usually just comes on overnight or over the course of higher training volumes and intensities. It's not always something that has to have a pop, as that's usually a hamstring tear. However, people that have had past hamstring tears can possibly have this in the future. There's not a lot of research to figure out really what common causes are of this. However, there's a strong correlation with pelvis and core weaknesses. Now, the intent of this video is mainly to show you different anatomical structures in the area, figuring out what your basic anatomy is and if you have this problem at all in the first place. Lots of people try to go through usually to figure out, hey, maybe I can find some videos on how to stretch this area, but the fact of the matter is you don't know if you have it or not. You should always go see a doctor to figure out 100% what it is, but at the same time, going in knowing anatomical structures yourself, I think it helps you figure out and communicate with your doctor better. What the person is going to feel, especially with this type of condition, is pain up in this area. It's going to hurt with resistance training as well as running at higher speeds. Palpation of high hamstring tendinopathies is really not that hard. All you got to do is find the area the person sits on and you ask them where their problem is. Obviously, if they have problems higher, you're looking at the dorsal sacral ligaments as well as the sacrotuberous ligament as we move up more towards the sacrum. Just to the outside, we're looking more at, say, piriformis or external rotator problems out here. And out here is actually where the sciatic nerve starts to travel down, so it travels just lateral to the ischial tuberosity. A little more inferior, you're looking at, so if you have the person contract against you, you're going to feel things pop up, and if they pop up and they're running vertically like this, then you're looking at the hamstrings as they travel up. Treatment-wise, these conditions seem to respond better towards soft tissue mobilization in the area to basically decrease the amount of scar tissue on the area, as well as take care of some of the tendon thickening. Usually what I like to do is basically I like to put a firm pressure on the region while increase in the range of motion or stretch in the area as well. Seems like it breaks up some of the scar tissue really well. And in addition to strengthening of the area, usually the runners seems like they do very well with this type of treatment plan. Strengthening of the area is a whole different story. There's tons of different ways to do that. I prefer eccentric loading of the muscle. I think it's safer. I think there's good research to validate it, and it's worked well for the patients that I've worked on. Third is you need to make sure that you're getting the athlete back into their volume and intensity slowly, and making sure that their coach or that you are the person watching them to make sure that their not only form is correct, but also too that they know what they're looking for. And controlling flare-ups along the way is a definite possibility. So you have to make sure that you're right there to handle those before they become major issues again. Treating high hamstring tendinopathies or tendinosis is way different than actually treating the musculature below. It's important to realize what you're dealing with when you have this type of issue, and realizing that I wouldn't tell the patient that they're going to get better immediately, because I've seen people with hamstring issues within the muscle belly that have responded very well within a matter of weeks, sometimes months, but usually a matter of weeks. These conditions do take a little bit longer, and it takes a little bit of extra care and really knowing what the athlete is dealing with their events coming up to make sure you're addressing it properly. Thanks for watching, everyone, and feel free to go onto the website, check out the other videos we have. I've been trying to put out tons of videos educationally to basically teach everyone how to know their body better. There's actually a book as well. It's called Prevention of Overuse and Sports Injuries. I wrote it. It was on 10 different cases that basically I've had that I see continually throughout the years, and it seems like there's lots of different common factors that these people have that they probably could have prevented if they would have known about it ahead of time. So go ahead and check that book out, and thanks for watching. Don't forget to check out our ebook at the website below.